In a world filled with busy schedules and endless distractions, taking charge of your health has never been more crucial. Welcome to a journey of empowerment, education, and well-being with HealthCheck with Dr. Nooristani.
Hi, I'm Dr. Ahmad Nooristani. I'm excited to invite you to join us on a quest for better health and understanding. You see, your health is your most valuable asset. It's time that we all take the reins and become well-informed about our health and well-being.
We've all been there. Doctors' offices bustling with activity, and time is often short. But here's the truth. Staying informed about your health is not just important, it's essential. Doctors may not always have the luxury to dive into every detail during appointments, and that's where HealthCheck comes in. Our show is your go-to resource for in-depth insights on important health topics. Whether you're curious about the latest medical breakthroughs, seeking advice on managing chronic conditions, or simply looking to lead a healthier lifestyle, HealthCheck has got you covered. HealthCheck with Dr. Nooristani isn't just another show, it's an opportunity for you to take control of your health journey. Being informed means you can make decisions that align with your well-being and make the most out of your visits to the doctor's office. But HealthCheck is more than just a show, it's a movement driven by people like you who believe that knowledge is power and that by working together, we can create a healthier, happier community. Dr. Nooristani isn't just a doctor with over 16 years of experience. He's passionate, he's an advocate for change. He's not only started 2 nonprofit organizations to help the uninsured, but also actively engages in the community to ensure that everyone has access to vital healthcare information.
So are you ready to take charge of your health? Join us on HealthCheck with Dr. Nooristani as we explore a world of possibilities. Learn from experts and hear stories that will inspire us all.
Tune in to HealthCheck with Dr. Nooristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health.
Welcome to HealthCheck with Dr. Nooristani. Since 2019, when we found out about COVID-19, athletes around the world has faced unprecedented challenges, not only on the field, but also off the field. One of those challenges are related to COVID-19 infection as well as COVID-19 vaccination. With us, we're gonna have a special guest, cardiologist, who is gonna weigh in about the risk and benefits of COVID-19 vaccination. We're also gonna be learning about signs and symptoms of sudden cardiac arrest and what to look for, not only as an athlete, but as just common folks. What should we pay attention to and when we should worry about it and when we should consult our provider. Over 100 to 150 athletes die every year due to sudden cardiac arrest or sudden cardiac death. That number has increased after COVID-19 infection and as well as after vaccination. Is there a correlation between COVID-19 as well as COVID-19 vaccination and cardiac arrest? Or there are other factors contributing to this? Is COVID-19 a factor or is the vaccine a factor? Stay tuned, you do not want to miss this.
On November 21st, 2021, my family was told by my doctor to prepare for the worst. Like many, I ended up with pneumonia thanks to COVID, cryptogenic organizing pneumonia to be exact, a very rare lung disease. I suffered major weight loss, couldn't breathe on my own. I also had an underlying autoimmune, which caused major complications. My body was completely depleted. So there I was, 49 years old, not vaccinated, fighting for my life, loaded up with prednisone and on heart medication to keep my heart rate under control. After being hospitalized for about a month, I was transferred to an extended care rehab facility to learn to walk again. This is where I started taking Balance 7 loyally. I knew I had a long road ahead, and after everything I had gone through, what did I have to lose? I was still on oxygen and heart monitoring. Doctors told me that the pneumonia could affect me the rest of my life. At that time, I didn't think I would ever live a normal life again. Balance 7 immediately helped me gain my strength back. At just 100 pounds, I was exceeding my physical therapy goals. My energy and appetite increased. Somehow it helped my overall health. My boyfriend contracted COVID and has been sick recently, and I did not get sick either time. My doctors are blown away. I have made a full recovery. I will faithfully take my Balance 7 the rest of my life. Balance 7 is my blessing.
Welcome back to the show. With us today, I have Dr. Gul, our special guest, that's going to be discussing a very important topic. Before I get into the topic, Dr. Gul, I want to thank you and welcome you. Thank you for taking time from your busy schedule to be with us here. Just tell us a little bit about yourself.
Well, thank you very much for having me on this forum. I'm a non-invasive cardiologist, and I work in a small town, Lompoc, and I've been working in a private setting and also affiliation with the hospital for about 15 years now. What we do is bread and butter cardiology, take care of patients with coronary artery disease, dysrhythmias, heart failures, and valvular heart disease. And we see a wide range of patients as far as the age groups are concerned. But I'm glad that we're able to help this small community of Lompoc, California.
Today, we're going to talk about the very important topic, sudden cardiac arrest, specifically in athletes. We're going to talk about COVID-19 itself and also vaccination and the effect of vaccination with sudden cardiac arrest. But before we get into those details, for our viewers, I want you to maybe simplify things and just give us some definition of what is cardiac arrest. Now let's start with that, and then we'll go deep dive into the details about the causes, prevention, etc.
First and foremost, cardiac arrest is an emergency. It's a medical emergency. And it is a medical emergency because all of a sudden the heart stops beating. Heart is a pump. It's a muscular pump. It stops beating. And what happens is that when the pump stops working, the blood flow to the brain is decreased or completely abolished. And that's going to have serious complications and consequences. Heart attack is not cardiac arrest. The two terms are, however, used interchangeably. However, heart attack can lead to cardiac arrest. So when cardiac arrest occurs, the electrical function of the heart stops working, and that leads to decreased pumping of the heart, and that leads to decreased blood flow to the brain and other vital organs. Now that can lead to dizziness, unconsciousness, patient can stop breathing, they lose their pulse, and if the blood flow to the brain is decreased or abolished, cardiac brain death can occur within a few minutes. So it is, like I mentioned, it's a medical emergency.
Let's know about what are the causes of cardiac arrest, just in general population. Then we can talk about specifically the causes of cardiac arrest in elite athletes.
There are numerous causes of cardiac arrest. So at the basis, it's decreased pumping mechanism of the heart, which occurred because of abnormality in the electrical function or the electrical properties of the heart. Now, basically, there are two major types of or causes of cardiac arrest. One is congenital or genetic, meaning the person is born with a condition, which could be hereditary, meaning that it runs in the family, and other type is acquired. As far as the congenital is concerned, we have what we call cardiomyopathies, meaning there's abnormal functioning of the heart muscle, which could be from some genetic mutation. So cardiomyopathy, then we have severe electrolyte imbalance can cause this. A blunt trauma can cause this. And we can discuss this further in athletes. And drug overdose. These are the few major causes. Now, these are congenital or patient born with this. Other things, other possibilities or other causes are acquired, where, again, drug overdose, electrolyte imbalance, infections or inflammation of the myocardium or the pericardium can eventually lead to cardiomyopathies, which can lead to cardiac arrest.
That's great information, Dr. Gul. We're going to take a quick break. And when we come back, we're going to talk about COVID-19 and COVID-19 vaccination and its effect on the heart, especially or specifically in athletes.
Are you looking to improve your health or restore your pH balance thanks to Balance 7? Balance 7 is a pH balancing supplement that promotes balance in the body's natural defenses. It's a mix of safe organic minerals that benefits the body with a burst of alkalinity. Now, this proprietary dietary supplement, when consumed according to the recommended guidelines, is crafted to help reduce buildup of acid in the body by neutralizing dangerous acids. Now, with this dangerous acid neutralized, the body is better equipped to self-heal, balance pH levels, reduce acid buildup, and maintain a strong, healthy immune system. And CEO Dr. Nooristani says Balance 7 is one of the key factors in jump-starting the journey to great health, serving its customers with natural and effective solutions to help them lead healthier lives. Now, for more information, just visit balance7.com or call 800-474-0558. Now, a special promotion is going on as well. You can get free shipping and a 4-ounce bottle of My Smooth Skin for new customers.
Did you know chemotherapy side effects are greatly reduced when the acid in your body's diluted? Learn how Balance 7 can support your well-being during treatment. Visit balance7.com or call 1-800-793-9039.
So welcome back. So Dr. Gould, we're going to continue that topic of causes of cardiac arrest, but this time we're going to mainly focus on the athletes. As we all know, in recent events, we had a couple high-profile athletes that had sudden cardiac arrest on the field. So I just want to get your take about, number one, what are the causes of cardiac arrest in athletes? Or is it different, or is it the same as general population, or there's the athletes just by who they are and how much they exert and put their body to the limit, that pushes them to have more of presentation as opposed to general population? And the second question will be about COVID-19 vaccine and COVID-19 infection itself and the cause of sudden cardiac death or sudden cardiac arrest.
Causes of cardiac arrest are pretty much the same for athletes and in general population. And again, like I mentioned earlier, I try to divide them in two different types. One is congenital, which could be genetic. Another one is acquired. And now in athletes, as far as genetic causes is concerned, hypertrophic cardiomyopathy is one of the most common cause of cardiac arrest in athletes. And it is very well common in general population. About 1 in 500 people have hypertrophic cardiomyopathy. The other causes of cardiomyopathy, which can lead to cardiac arrest in general population, would be, again, what we call right ventricular dysplasia. We can have some electrical abnormalities such as long QT syndrome. We can have another type is called Brugada syndrome. So these are genetic, meaning that there's a family history of this disorder. Now, other type is what we call acquired, meaning there is no genetic abnormalities. The person is normal at birth, but over time they can develop some sort of cardiomyopathy, which can lead to cardiac arrest. In athletes, the most common that we see is what we call commotio cordis, which is a blunt trauma to the anterior chest wall. And again, in a cardiac cycle, it happens at a sort of time that would set off the electrical abnormality leading to cardiac arrest. Extreme exhaustion or workout can lead to cardiac arrest. Now, this usually happens in the setting of electrolyte abnormalities, which low magnesium, low potassium, in somebody who has either a genetic makeup can lead to cardiac arrest. One more thing I would like to mention is drug overdose or certain drugs, which can cause cardiomyopathy, or drug abuse in the long run can cause cardiac arrest by way of causing cardiomyopathy.
Now, in your practice, you're seeing thousands of patients since 2019 when COVID-19 came about. Now, Are you seeing a lot of patients who had COVID-19 infection who came in with different cardiomyopathies or heart disease, and you had any patients that also didn't have the COVID virus but had COVID vaccination and now presents with cardiac abnormalities?
Both with COVID-19 infection and the vaccination for COVID-19, we have seen some degree of effect on the heart. And usually there are either inflammation of the myocardium called myocarditis, or inflammation of the pericardium, which is sac in which the heart sits, called pericarditis. Now, these myocarditis, if not treated, can eventually lead to cardiomyopathy and can lead to cardiac arrest. Now, in my practice, I have seen numerous cases for pericarditis and then myocarditis, but I have not seen cardiomyopathy. But like I said, if untreated, myocarditis can lead to cardiomyopathy and can lead to cardiac arrest. Same thing with COVID-19 vaccination. We have seen inflammation of the pericardium and the myocardium after the patient received vaccination. Now, there's a difference in age group as far as the occurrence of or incidence of the effect of the heart, either by COVID-19 infection or by the vaccination. We have seen that the younger group age groups are usually the ones which are affected by the vaccine, and they present with either myocarditis or pericarditis. However, if the heart is affected by COVID-19 infection, they're usually the older age groups.
Thank you for those information. We're going to take a quick break. When we come back, we're going to talk about prevention and also talk about ways to keep our heart healthy. We'll be right back.
I suffer from stomach problems due to a lot of medication. I also suffer from depression, and since taking Balance 7 for the past 4.5 years, I see major improvements in both these areas. Thanks, Al, for creating Balance 7.
Did you know fatigue and energy levels are directly related to too much acid? Restore your vitality with Balance 7. Visit balance7.com or call 1-800-793-9039 to embark on a healthier lifestyle.
Welcome back. Dr. Gould, so based on your experience and what you have seen over the last 3 years with COVID-19 infection and effect of vaccination and athlete's heart or anybody else, do you personally would recommend people get vaccinated, knowing the facts, knowing what are the data that's available? We know definitely that there's a rise in cardiac events after COVID-19 and vaccination. That percentage is obviously not huge. There's not significantly different, but obviously social media, high caliber or high-end athletes getting injured shed a lot of light and controversy over that. So based on your experience, what is your recommendation for those athletes or population in general pertaining to heart and heart problem and sudden cardiac death?
So that's a very good question. I've had numerous patients questioning about the effects of vaccine on the functioning of the heart. And as I mentioned, COVID-19 vaccination and COVID-19 infection both can affect the myocardium, can cause myocarditis, affect the pericardium, and can cause pericarditis. We have the incidence, which is not very high. But at the same time, this is a concern. So as far as my personal opinion, and I think this is also the opinion of guidelines from American College of Cardiology, that the benefits of COVID-19 vaccination outweigh the risk of occurrence of inflammation.
And when it pertains to athletes, I know every year about 100 to 150 of the athletes in general have sudden cardiac arrest, sudden cardiac death. Those has been around for ages. Now that percentage have increased maybe about 0.04%, but nonetheless, I mean, there's 100 or 150 people that life could be saved. Are there any measures more than what we have done so far as prevention concerned? I know these athletes get their physical, their history, and they do the basic electrocardiogram or the little machine they put around to look at their heart rhythm. That has been done. Is it enough, or should we do more as in general, as a healthcare provider, as professional athlete, and our organization, in order to protect these athletes and being proactive about it? Do you have any recommendation for those athletes or for elite athletes or anybody else in general in order to prevent the sudden death or arrhythmias that follows?
We don't have any mass screening for these conditions in general population or in athletes. What we are doing is what we call targeted screening, which means that if an individual has family history of sudden cardiac arrest, if some family member has been diagnosed with some genetic mutation which has caused cardiomyopathies, we sort of what we call cascade screening. We screen the first degree relatives of the affected individual. The most common cardiomyopathy is hypertrophic cardiomyopathy, both in athletes and in general population. And as I mentioned earlier, 1 in 500 people have hypertrophic cardiomyopathy. So it's fairly common if you do the numbers. So I think what we have to do is especially in athletes, we should do some sort of a pre-screening, a pre-athletic workup to screen for these conditions such as hypertrophic cardiomyopathy. That would include history and physical, family history, and then a test what we call echocardiogram, which is an ultrasound of the heart, which can diagnose hypertrophic cardiomyopathy, which is a thickening of the heart muscle, which is more than a normal heart muscle.
Dr. Gould, thank you for being with us in a short notice, and also in this time where there's a lot of controversies and a lot of people have a lot of questions in regard to this topic. So thank you for taking the time with us. We'll be right back after these messages.
Did you know by diluting the acid in your body, you may experience less joint pain? Take control of your health with Balance 7. Visit balance7.com or call 800-793-9039. 800-793-9039.
Welcome back. And I hope you have learned from Dr. Gould what to look for when it comes to cardiac arrest. The stories of star athletes like Bronny James, the son of LeBron James, famous basketball player, and Hamilton, Buffalo Bill football player, serve us as a powerful reminder that we have to be vigilant and proactive in taking care of our health. Many of these diagnoses goes unnoticed because the symptoms are not presented to us or to the patient itself. If an athlete is on the field and experience sudden cardiac arrest, most of the time they do not report any kind of symptoms. If you look at the data over the past decade or so, about 30% of athletes actually report prodromal symptoms or symptoms before they had the sudden cardiac arrest or sudden cardiac death. Those symptoms are including lightheadedness, chest pain, difficulty breathing or shortness of breath, palpitation or where your heart is racing, lightheadedness that leads to syncope or passing out. Evaluation of these symptoms are extremely important because that will lead to saving life. We have to be proactive when it comes to our own health. And most importantly, if you have any of those symptoms or sign of those symptoms, you need to go to your provider. They need to take a detailed history, physical and family history, and make sure that those visits are tailored to you. And once again, I'm emphasizing the tailored approach to your health. So if you're an athlete, you need to take all those steps in order to safeguard your health. Till next episode, I'm Dr. Nooristani. Have a healthy and happy day.
Tune into Health Check with Dr. Nooristani weekly to gain insights that can transform your health journey. Let's build a healthier, happier community together. Get ready to be informed, inspired, and tune in with your health. See you on the next episode of Health Check with Dr. Nooristani.
Not Balance 7 is for you? Well, if you care about your health or have ongoing health issues, then I must say that yes, this is for you. Dr. Nooristani, a licensed physician and practicing MD here in California, has witnessed the benefits of Balance 7's natural power. Dr. Nooristani did all of his own research and testing of Balance 7.
I love Balance 7 so much, I became the CEO of the company and continue to stand by the product 100%. I recommend Balance 7 to anyone who has any health issues. You might be suffering from joint discomfort, mental fogginess, and indigestion. I'm amazed how Balance 7 helped my patient go through chemotherapy with minimum side effects.
I was diagnosed with incurable lung cancer, stage 4, and given 2 years to live. As far as I'm concerned, Balance 7's done a wonderful job along with the chemo. My hair's growing back. The doctor at the hospital was amazed at how much of the cancer had shrunk so fast. I definitely recommend it to anybody, whether it's cancer, Alzheimer's, and heartburn. It's not just for cancer. I mean, you got any aches or ailments? That's what I'd suggest. Try on.
Give Balance 7 a try. You will not be disappointed. In as little as 3 days' time, you will see the effect.
And the best part is you have nothing to lose because we offer a money-back guarantee. Balance 7 contains all natural ingredients and is safe to consume. This is a specifically formulated alkaline concentrate with a very high pH. Balance 7 restores your body's pH levels, allowing your body to start healing itself from within. When used in small 1-ounce doses 3 times a day, it will dramatically reduce acidity in your body. This will allow your immune system to operate at peak efficiency, so your body can better fight diseases on its own. When used with daily exercise and a good diet, Balance 7 can have a very profound effect on your health. So drink up and celebrate a healthy life. Try the all-natural self-healing powers of Balance 7. Meet Al Simon, founder of Balance 7, who refuses to believe that because he's 92 years young, that it's normal to feel sick and have joint pain. Al works at the Balance 7 offices every day and is involved in all of the day-to-day business decisions. As a matter of fact, his staff has a tough time keeping up with him. Balance 7 has a very peculiar taste. It's a great barometer to tell you what condition your immune system is in. To help with taste, please feel free to refrigerate. Start enjoying life again with Balance 7.
Did you know acid buildup in your body is responsible for the majority of diseases? Discover how Balance 7 can help you maintain a healthy pH level. Visit balance7.com or call 1-800-793-9039. 1-800-793-9039.
The opinions and statements made by guests on this show are their own. Noble Productions does not constitute an endorsement or validation of what is discussed.